Hi everyone, welcome to another video. If you want to learn more about nursing care plans, how to navigate subjectivity, if you want to learn what your lecturers might be looking for, this is the video that you want to watch. In this video, I am going to look at a care plan that was submitted by a student, taken from the original document and placed on a blank document to protect the student's identity. So if you want to learn more, don't go anywhere. One look and I breathe. All right, so students were given short scenarios and were tasked with identifying the priority nursing diagnoses and creating a care plan. I also asked students to include data they would assess for if the patient was in front of them. That would have given me a good idea of how the student is thinking in terms of assessment and to get to assess the assessment knowledge that the student has. So let's look at this one. I tend to look at the nursing diagnosis label first before reading the assessment so that I can identify if the student has irrelevant pieces of data in the assessment or if they're missing relevant pieces. Excuse me. So this label is impaired gas exchange. All right. So the patient reports worsening dyspnea and fatigue over the past week. Is it related to impaired gas exchange? Yeah, somewhat. So let's leave it. Be careful with the mention of another symptom, which can be diagnosed by another label. Just don't provide too much data about that additional symptom since it can be diagnosed by a nursing label. The patient reports gaining 8 pounds in the last week. Is this relevant to an impaired gas exchange? Not directly. Not directly. Could be evidence of fluid accumulation, which would be evidence of the problem, but not necessarily something that's related to directly related to the problem of impaired gas exchange. But we'll leave it there since it could be evidence of the fluid accumulation, which I think she has mentioned over here. The patient expresses discomfort from bilateral lower extremity swelling. So we are not addressing discomfort here. So there's no need for us to mention discomfort here. So this would be a piece of data that's irrelevant to the nursing diagnosis that we have here. She could have mentioned the lower extremity swelling, which would also be evidence of the cause, which is fluid accumulation. But because it's still not directly related to gas exchange, it still wouldn't be like a key piece of data in this care plan for this label. Respiratory rate, 26 breaths per minute, definitely relevant. Oxygen saturation of 92% on 2 liters nasal cannula, relevant. Bilateral crackles heard at base of lung. I ask students to provide more details about the adventitious sounds that they document, especially since students are required to write short term goals in exams. So you want to be very, very specific about the abnormalities that you find during assessment so that you are able to write about minor changes in your goal. You can aim for minor changes. So, for example, if she had said harsh crackles heard, instead of just crackles heard. She could have aimed for the crackles to not be so harsh in the goal in a short space of time because it can be challenging to find short term goals. So, more specificity in the assessment really, really helps with that. Bilateral pitting edema in lower extremities, also proof of fluid accumulation. While not directly related to the lung function, we can accept it. Additional data that would have been great here would be a chest x-ray showing fluid in the pleural space, for example, ABGs. While ABGs are not necessary to make the diagnosis of impaired gas exchange, it would have been good to have them here as long as they're available. But that's just two additional pieces of data that she could have included. She could have also included data about the cause of the fluid accumulation, because while we are addressing impaired gas exchange, since she has highlighted the cause to be fluid accumulation, it would have been good to identify the reason for that fluid accumulation, because it might be something that we have to address in our interventions. And you don't want to have your interventions be baseless. Your interventions must be based on how the patient presents, and it should be helping to achieve the goal that you've written. All right, so now that we've spoken about the assessment, let's look at the nursing diagnosis. Impaired gas exchange related to fluid accumulation in lungs secondary to decreased cardiac output, as evidenced by dyspnea, crackles in both lung bases, and oxygen saturation of 92% and 2 liters cannula. I think this was a grade that I had provided. All right, so let's go again. Impaired gas exchange related to fluid accumulation in lungs is acceptable. Secondary to decreased cardiac output. Now, this is the issue. This is the very first time we're seeing decreased cardiac output being mentioned. And while it's okay to have it as secondary too, we must have seen this mentioned in the assessment data before, because where is it coming from? So a key thing to remember about nursing diagnoses is that we should not be surprised by data in the nursing diagnosis. So this is new data, which means that this piece of data should have been in the assessment, so that we're not over here saying, oh, she has cardiac output problems. Oh, that's why there's a problem with fluid accumulation. No, we shouldn't be surprised, right? We should have already been notified of it in the assessment. So that's an issue here. And that's really my only issue with this nursing diagnosis. Everything else is okay. I would have loved for additional assessment data, as mentioned before, and then we could have had those over here as well as additional evidence or defining characteristics. Excuse my voice, it's going. I've been talking a lot lately. Goal. At the end of 2 hours, the patient will report improved breathing with oxygen saturation increasing to greater than or equal to 94% on 2-liter nasal cannula, and a reduction in respiratory rate to 22 breaths per minute or less following nursing and collaborative interventions. Now, I know to the untrained ear, this sounds perfect, right? It sounds accurate. But there's actually something missing here. There is no real goal. Remember that a goal is a broad statement, something that you want to achieve as it relates to the problem over here, either the label or the cause of the problem. No, she has 3 out of the 4 parts of the goal. Bear in mind that you should have a subject, verb, condition, and criteria. At the end of 2 hours, that's a condition. The patient will report the patient will report is part of a verb, improved breathing with oxygen saturation increasing to or greater than 94% and 2 liters of oxygen via nasal cannula, and a reduction in respiratory rate. These are actually criteria. These are things that we will measure, these are things that we will see, but what will they indicate? So, what they will indicate would probably be an improvement in gas exchange. So, that's the goal. The patient will achieve an improvement in gas exchange, as evidenced by patient reporting improved breathing, oxygen saturation greater than or equal to 94% on the 2 liters, and a respiratory rate of 22. So, there was condition, subject, there was criteria, but there was no verb here. Think of the verb as the broad goal, and the other parts just helping to get the goal statement together. So there was no real goal here, just things that we hope to happen. So these were all expected outcomes. Expected outcomes are different from goals. And I know sometimes students have patient outcomes here, which is different from having a goal. because it can have expected outcomes, which are part of a goal statement, which are just things that you hope to have, measures that you hope to achieve. But what does achieving these things mean for the problem that you're trying to address? Let's look at the interventions or rationales. All right. Administer prescribed oxygen therapy 2 liters via nasal cannula. Rationale: oxygen therapy improves oxygenation, addressing hypoxemia and reducing the workload of the respiratory system, thereby improving gas exchange. This is acceptable. Addressing hypoxemia gives the impression that the patient is hypoxic, which I'm not seeing any evidence of, so we have to be careful um, about what we write in our rationals. Position the patient in high Fowler's position with legs dependent if tolerant. Now, when we say we're going to position a patient, or when we say we're planning to, because their interventions are what you're planning to do, we're planning to position the patient in high Fowler's position. It begs the question of, so what position was the patient in when you assessed them? And if you saw them supine, you should indicate that in your objective data, because that's a consideration for the patient's care. Also, think about your interventions in the order in which you will carry them out. Chances are, if our patient is lying flat on the bed, we're going to reposition them first, right? It's probably one of the very first things that we're going to be doing. Administer prescribed diuretics, furosemide, to monitor the patient's response. Sorry. No, administering the prescribed diuretic is fine. You can actually put prescribed medications in your assessment, by the way. However, adding monitor the patient's response makes it an incomplete intervention. So, in addition to the administration, she wants to monitor the patient's response. Put a timeline whenever you mention monitoring. And if your monitoring means it's something you're going to be doing once, that's actually a reassessment and not a monitoring. Rational diuretics help reduce fluid overload, decreasing pulmonary congestion and peripheral edema. Monitoring ensures efficacy. I love that she has justified the monitoring. Ensures efficacy and identifies potential complications such as electrolyte imbalances. Okay. Okay. Encourage. No, there is a general problem with the use of the verb encourage among some educators. And I think I've never really had this discussion, but I think the reason for this is because students tend to not be very specific when it comes to explaining what they are encouraging. And it tends to sound layman. So the advice is to use a different verb. As a matter of fact, you could say advise, instruct, instead of encourage, because you tend to provide more explanation when you use other verbs. But if you use encourage and your intervention is highly specific, it should not be a problem. But approach with caution. Encourage and assist. So she's using two verbs here. The patient with deep breathing and coughing exercises every hour while awake. All right. So not only is she going to encourage, can the intervention stand alone with encourage? For example, can we say encourage the patient with deep breathing exercises every hour? No. So it has to be formulated in such a way that both verbs apply. Can we assist the patient with deep breathing and coughing exercises every hour? Yes, but she still needs to state exactly what she will do to assist the patient. It's not specific enough. What are you going to do? Are you going to provide instructions? Are you going to teach them certain techniques? Are you going to supervise them using the incentives parameter? How are you going to assist this patient? So I had some technical difficulties, but let's continue. Monitor respiratory status closely every hour. So, monitoring is also one of those verbs that are frowned upon. So, one of the new recommendations is to say measure and record. because that's exactly what you're going to be doing when you say monitor. So measure and record the patient's respiration instead of saying respiratory status. Be specific about what exactly you're going to check. So if you're going to be checking the respiratory rate and the SpO2, go ahead and say that. If you're going to be reassessing breath sounds, go ahead and say that. And I think that's it for interventions. Let's look at the evaluation. Goal met after 2 hours of nursing and collaborative interventions. The patient reports. So, because evaluations are conducted after implementation, meaning after we've carried out the planned intervention, we would evaluate. And then after evaluating, we would go and document. That means our evaluation must be documented in the past tense. So it should be patient reported improved breathing. And because the patient would have had to say something for us to draw that conclusion, go ahead and write exactly what the patient said in quotation marks. With oxygen saturation increasing to greater than or equal to 94. Again, we would have checked the oxygen saturation, so we would have had a very specific reading. So the specific reading is what should be here. And 2 liters nasal cannula and a reduction in respiratory rate to 22 breaths per minute. So these are all expected outcomes. These are all outcomes. But what was the goal? What does this mean for the problem? What does this mean for the impaired gas exchange or the fluid accumulation? What happened as it relates to that? Because these are all outcomes. These are all things that happened. But what was the goal? What were we aiming for? So this is what I mean when I said there was no goal. I hope you found this very useful. If you did, go ahead and let me know in the comments and also make any suggestions for future videos. I'm thinking about making this a series based on your feedback. So go ahead, don't hesitate to provide feedback and don't forget to subscribe. And tell your friends about the channel. Bye.